This is Dr. Emil Tassi, your health and wellness coach. If you made it back to this second video, this is telling me that you're looking to make changes. Well, I can tell you this, results speak for themselves. But before we go into that, I just want to make the point that your health and building your health up is a primary concern to me. I want you to think about this for a second. Your health works on a continuum. Your health is dynamic, meaning this. It's either moving up and you're building your health, or your health is going down. It's never staying the same. We want to consistently build your health up. You should always consider this question from now on. Is what I am doing right now building up my health? What's your definition of health? When I ask this question, I get two main answers. I feel good, I look good, I must be healthy. Now, obviously, many of us are to the point where we don't feel good and look good, and we know we're not healthy. That tells me that you're in the right place and you're ready to make changes. The ultimate goal is to build up your health, because I want you to think about something. Health, what is it? What does it mean to you? If I asked you what is your greatest asset, what would your answer be? What are the things that you are passionate about and you love the most? What actually gets you up in the morning? It may be spending time with your family, maybe traveling, maybe you love to work or you own a business. Maybe you love to go out to dinner, maybe you love to walk on the beach or go on the boardwalk or go out to a movie. Whatever it is that you love to do, what are you passionate about? Maybe you have a hobby. Maybe you haven't been able to do a lot of these things in a really long time because of your health, because of the weight. That's a real issue. I want to give you this definition when it comes to health, okay? I want you to realize that health is optimal function and not merely the absence of disease. Ask yourself this, what is it in your body that controls and coordinates all of the functions in your body? It's your brain and your nervous system, okay? So when we're looking to get weight off of people and we're looking to get them healthy, we want to focus on their neuroendocrine system, and that's exactly what we do, okay? Getting the weight off will absolutely lead to you looking and feeling better. However, when we know that true health is optimal function, well, that's another story, because it opens up more questions. It opens up the question of this. Do you just want to get the weight off, or do you want to get healthy, or do you want both? Listen to what Larry says in this interview. It's amazing. All right, we are here with our rock star, fat burning machine, Larry Lover. So tell me, tell us actually your journey, man. Tell us what's transpired over the last several months, and just where you were, and even before you came in, because I know you didn't come in for a while.
Right. Before I came in, I was post-surgical L5-S1 laminectomy when I was 21 years old.
From an injury?
From an injury.
Okay.
I was hesitant to have anybody touch my back except the surgeons, and that was it. Until a family friend recommended, my weight was coming on, my medications were going up, I was getting more and more sedentary, until a family friend recommended Dr. Tassi and kept hounding me to come.
How long were they hounding you for? Because sometimes that...
About 2 to 3 months, to be honest.
Okay. I don't want to go past that point as fast as we usually do with people. I want to just make the point that a lot of people right now are skeptical, or they're hesitant, or they don't trust, they don't know what to do or who to trust or where to go. And like you, I don't know what your mindset was, but a lot of times we can't get out of our own way. We're paralyzed as far as, not doing anything, not taking any action. So, what were the reasons why you were waiting? It was just...
I was more scared than anything
Yeah.
for anybody to touch my back.
Right. And what about the weight loss? Because I know that she was...
Well, like I said, the weight just kept coming on and my medications kept going up. And she finally said to me, listen, call Dr. Tossi and go. So I waited and I hesitated, and finally I came,
Yeah.
and it was the best thing I ever did.
Awesome. So then you came in.
I came in for Lighten Up.
Right. So.
And then I started with the chiropractic care.
How was the journey like? So before you, as far as the weight, what was life like before you lost the weight?
It was getting less and less.
Okay, so.
I was just sitting around.
Yeah.
I got to the point where I couldn't tie my shoes no more.
That's horrible.
It's pathetic.
It was almost like just an existence.
Exactly.
Because now you're so fired up.
Yeah.
And you're really, you're doing amazing and you're on a mission to help other people. So how many pounds have you lost?
90 pounds.
90 pounds. That's amazing, man.
And I went from
so
a waist, 48-inch waist, I'm down to a 32.
That's the pant size that I wear. That's amazing.
I couldn't believe it myself.
That's cool.
I feel great.
How was it going through the program? Like, talk about going through the program.
Going through the program was great.
Okay.
The support was there. You guys, if I had any questions, you answered them right on the spot.
Nice. So you felt like it was doable.
Yes.
It's not always the easiest thing for people. Sometimes
it's not the easiest, but you make up your mind, you do it.
But it's necessary.
Right.
And change isn't always comfortable, but it's necessary. And that's the key thing. People might be sitting here right now saying, yeah, I know it's a lot of work. I don't know if I'm ready to make these changes. But if you don't do it now, what's life look like for you in another 6 months? If you would have just kept letting it go,
I probably wouldn't have been here.
Right. You know what I mean? And that's where it really can get to.
Yeah.
Is where, you get to the point, now you're down 90 pounds and you are just, a totally different person. I mean, you're totally different from
when you came in here. It got to the point where
I
didn't want my picture taken no more.
Yeah, not even physically.
I didn't want to go to no functions. I didn't want anybody to see me.
Yeah, now your pictures are all over the place.
Now I'm all over the place.
We have your pictures on the flyer. Yeah. We have you doing video. And that's because, we love you and we appreciate you, man. Yeah. And, I appreciate you doing this because how many people out there that are sick and suffering that don't know what to do?
Don't be like that.
We have the answers.
Yeah.
And it's understandable for people to be skeptical, but that's the difference between just walking into some random place or ordering something online versus coming into a holistic wellness center with experts and doctors that are going to oversee the process, and it's customized.
Yes.
And that's the difference. So, awesome, man. Larry's cardiologist has sent us several patients because he says that what he discovered on Larry and with his case was that Larry's heart muscle actually shrunk and became healthier. He took Larry off all his blood pressure and cholesterol medications. We have had several patients get completely and become completely cured of diabetes after being on medications for several years. They have been able to completely get off their diabetes medications. Their endocrinologists are blown away. I want you to take a look at this picture of Liz. She's one of our patients who lost 80 pounds in just 7 months. Her life has been completely transformed and changed. Are you ready to transform your life? If you're ready to take action right now, which I highly suggest you do, call us at 516-255-4040. That's 516-255-4040, and we'll set you up to come in for a nutritional consultation. Normally, it's $99 to have a Tanita scan done in our office, which is going to check for a bunch of parameters. But if you call today, we'll give it to you for $29. Call our office, and I look forward to seeing you.